Bismillahirrahmanirrahim. This is Physiomed Ionoson expert, and today I'm going to show you all the parameters or the currents that are available in this and all the features. So this is a very advanced electric stimulation unit. Basically, it's a combination therapy unit. Let me tell you what is a combination therapy unit first. A combination therapy unit is a unit that allows you to use therapeutic ultrasound and electric stimulation simultaneously all together. So it is called as combination unit or combo unit to be short. Now in this screen you are looking at this, or these are all the currents that you can use. They have galvanic current and dynamic currents and TENS and Faradic stimulation and interferential and COTS and some other currents. Over here, this is for ultrasound. The ultrasound is dual frequency 1 and 3 megahertz, and you also have electrodiagnostics in it. The electrodiagnostics that are used by the physical therapist, they have a lot of purposes: to see for accommodation, to look for the state of nerve injury, to look for the regeneration, and so many other things, healing state or degeneration, some things like that. Then you have indications. You can use this device based on the indications, and then you have different settings. So these are all the currents you can see. For example, this one is for iontophoresis, so you can use it for iontophoresis. Iontophoresis is used by a physical therapist to treat a lot of conditions. That includes one condition in which there is a lot of sweating in the hands and feet, which is called as hyperhidrosis. So it is very good, and for painful conditions in which you want to drive the drug inside, or the ionic form of the drug inside the body. Here you can see this is for pain. Again, diaphasic and monophasic, all of these are for pain. Now this is also for pain and this is for detonization, that if you want to reduce the spasticity, you can use the high voltage current. TENS is for most commonly used for pain, but again you can use it for a lot of other purposes. You can try to produce the endorphins inside the body. You can also try to produce opiates, the natural opiates in the body, as well as you can try to lower the muscle tone or increase the muscle tone, and so many other things. This is for hyperemia, if you want to increase the blood supply. So hyperemic reactions, if your desire is to improve the blood supply, you can use IG, interrupted galvanic 30 and 50. And this is for again detonization. This is for again stalk stimulation for hyperemia, and this is for muscle stimulation, the Faradic type of current, which is used for partial nerve injuries as well as for muscle strengthening and muscle re-education purposes. And again, high voltage stimulation is for muscle stimulation. This is for tetanic or some other stimulation. This is least commonly used, but again it is available over here. And interferential four polar is for using the four poles simultaneously, which is a classical interferential. You can use the non-classical interferential, which is two polar interferential, which is very easy to use sometime. And this is AMF, this is MT, and this is COTS, again muscle stimulation. If we go to the ultrasound, we have this self-test system or function first. Then it will calibrate the head, or try to calibrate the head. Once it is being calibrated, it will tell you that what is the frequency or what is the time. So here you can see, you can select the mode. The mode can be 1 megahertz, or the mode can be continuous or pulsed. Here you can see this is right now continuous. If I change the mode, these are the pulse ratios for the modes. So let's assume that we want to use the continuous mode, and we have this frequency of 1 megahertz and 3 megahertz. We can change it very easily. And this is for stimulation. If you want to include the electric stimulation, you can use the electric stimulation along with it. And this is for audio output. So the maximum output of this unit is pretty high, and you can set the output into watt or watt per centimeter square. So these are the electric currents that you can use along with the ultrasound, and that is the reason it is called as the combination unit. All the currents can be used. So let's try to go back and let's go to the diagnostics. So we have the Faradic excitability test, which is a very good test to know if there is a Faradic response. It means that there is some innervation, whether it can be partially innervated or whatsoever, but there is some innervation. If the muscle is responding to the Faradic current, it means that there is innervation and the muscle is being innervated. Medium frequency test, Lange test is also there for, again, you have accommodation quotient to look for the response of the muscles, how quickly they accommodate or accommodate to the currents. And Rio base and Conaxi, this is a very basic and very important electric test, the Rio base and the Cronaxi, which is done almost together. So I will call it as a single test, although people call it as two tests, the Rio base and Cronaxi, but they are part of a single test. They tell you about the electrical excitability of the muscle and what are the minimum duration of intensity and time required to elicit a muscle's contraction. And then you have IT curve, or intensity and time curve. These are all the electrodiagnostic features. Then you have indications, so you can select on the basis of indications. If you have patients from a lot of pain, let's say from the shoulder pain, you can select from the preset program. Let's say this is not for the upper one, is ultrasound, this is for electric stimulation, so you can select this. It tells you that what currents can you used, and intensity should be barely perceptible, the time should be from this to this, and how much you need to apply it, for example, on daily basis or possibly 2 times per day. Everything is written in it, so you can take help from this. If you want to see the picture, here you can see the electrodes, the positive and negative. You can see the channel 1 and channel 2 as well. So this is very helpful for those who are very new to electrotherapy. And let's go to the other functions. These are individual programs. If you want to save any program, you can override these functions and you can just go to that program later on. And this is for the settings menu. You can increase or decrease the display's contrast. Here you can see, and the contrast can be increased or decreased. So lastly, you can select, if you turn on the unit, what should be the display setting, the previous current or the main current. And this is for the next is for the type of waveform that you want to use. Here you can see this is symmetrical and biphasic, and if I change it, this is also symmetrical biphasic, but this shape is totally different. So you can select these type of waveforms and then you can go back. So this is a brief overview, and let me show you the overall view of this machine or the display of this machine. So here it is, you can see the unit is turned on, and this is a selection menu, or you can say the navigation menu. These are two intensities, and this is the ultrasound probe with this. It is in immaculate condition, it is really very fine, and it has also a light indicator along with it. And look at the, so this is the real wire. You can see it has 2 channels and 4 electrodes, and this is pretty good quality, and this unit is in immaculate condition. If you want to know more about this, do let me know. Thank you.